your chat box handy and want to open that up. We have some questions here to get everybody warmed up this morning. Hey, Dale.
Hey, Christy.
All righty. While we're waiting for people to join, we're going to have some fun state facts. So this is our first question up. If you want to use your chat box, to type the answer. I'll give you some choices here in a second. So which state has the highest number of PhDs per capita? And the options are Texas, New Mexico, Utah, or Montana.
How do you put in your answer?
All right, we've got New Mexico in the chat box. All right, that was Caitlin. And Caitlin is from, remind me, Caitlin, Montana, right? Yep, okay, so Montana gets those points. There you go. And our next question is, which state was the first in the US to elect a female governor? You can type it in the chat box, and these are your options. Arizona, Nevada. All right, looks like Amy says Wyoming first. Great, 100 points. And Amy is from Wyoming, and maybe that's how she knew that. Good job. All right. And question number 3. Which state invented Dr. Pepper? Your options are Wyoming, Texas, New Mexico, or Nevada. I see a Texas from Daphne. Congratulations. So we've got 100 points going to Texas. Daphne's from Texas. Again, maybe that's why she knew that. All right. We will play some more a little later, so stay tuned, but thanks for warming up with us. And I'm gonna stop sharing that. And get our slides up. Daphne's been to the Dr. Pepper Museum. Wow. All right, thanks everyone for joining. We have just about a minute left till we'll get started. Good to see everyone this morning. Thanks for having your cameras on. I know it's the next best thing to being in person. Thanks everyone for joining us this morning. Lots of friendly faces. We have snow here in Pennsylvania, so it goes with our theme today. Guessing maybe other parts of our region might have some snow too. All right, that brings us to top of the hour, so let's kick it off. Welcome to Mountain States Regional Genetics Network's virtual winter meeting. We are so excited to have you all here. And we want to start off with a statement from our funders. We thank HRSA for the support for this work. Could not do it without their financial support and leadership. Just a couple Zoom logistics. I'm guessing most of you don't need to know about these, but for anyone who is new to Zoom, if that's possible these days, this meeting is being recorded, so we will have an archive for those who are not able to attend. Just a little Zoom navigation at the bottom there. Everyone has entered in mute, so if you need to unmute, that's #1 flag there. We would love to see your smiling faces, so if you want to turn on your camera, you can do that where the #2 flag is. You want to see who else is online? You can see the participant list at number 3 there on the bottom of your screen. And questions and comments will be primarily taken through the chat function, which is number 4, which hopefully those who joined early got to practice using with our trivia game. More to come on that later. So just a little intro, who's who. We have Kathy and Janet, our project co-directors, joining us today. Ankit and Sherry are THI administrators. Ankit's the CEO and Sherry's the COO. Have myself, Christy Weiss, as the projects manager. Joyce is joining us today as our estate teams coordinator. Cody as our projects coordinator, and Liza as our evaluator. And Stephanie and Katie are with us today behind the scenes helping us. They both work at THI in convenience and education. And they are important people to remember, because if you have any technical difficulties whatsoever, please message them in the chat. I will not be seeing the chat a whole lot today because I'm being mistress of ceremony. So please reach out to Stephanie or Katie if you have any questions. All right, here's a snapshot of our agenda for today. We do have some breaks built in. We have some fun built in and some great presentations, not only by our state teams, but some of our partners. Just a note to please attend a breakout session, even if it's not your state presenting, just to support our entire region and get some ideas from other states as well. The purpose of our meeting today is really to bring together our Mountain States membership. So we have with us our state team members, our advisory council members. We also have our genetic ambassadors and our state team co-leads, and of course our management team. But we wanted to bring everyone together to do 3 things: to share the progress on 6 initiatives from our new grant cycle, to foster state team collaboration, and last but not least, to launch 4 surveys for 3 new initiatives and ask for your help in sharing the word about those surveys and initiatives. So our takeaways today are going to be a genetic gasp, and I'll tell you more about that in a little bit, and 4 survey links, and we'll have those provided for you throughout the presentation. Whoops, there we go. With that, I am going to introduce Janet Thomas, who is our project co-director for Mountain States, and she is going to kick us off with a presentation of our new grant initiatives and our grant overview. And with that, I will stop sharing my screen and turn it over to Janet.
Janet, you are on mute if you're speaking right now.
There we go. All right. So I got a thumbs up from Christy that my slides, and I got a thumbs up from Stephanie that I'm no longer on mute. So I guess we're good to go. So welcome everybody. It is sad to be virtual these days, but I think we'll take what we can get. It would be so much nicer if we were all in person, and maybe by the end of the year we can do that once again. Until then, we'll do our best to present the information today and get a lot of good feedback as we move forward on this grant cycle. So my job this morning was to present a quick overview of this grant cycle. And let me just, oh, that's not gonna, so. There we go. So just kind of as a very broad overview, we have 6 initiatives. We have sort of 3 from the past grant cycle and 3 from our new grant cycle. And I'm thinking these brought up an older slide set actually. So, and so we're going to touch base with each of these 6 initiatives. We have smaller projects as well, but these are our kind of 6 big initiatives that we're going to touch on. So we'll start with the kind of the three old initiatives that I think everyone is largely familiar with. The first is our state teams. And the state team model, as you all know, was established in the last grant cycle. And we felt it was such a big success that we did continue it throughout this grant cycle as well. I think most of you are familiar with the model of the state teams, and that we hope that each state team has 2 co-leads, as well as broad stakeholder representation. And by that, I mean, you know, geneticists, primary care physicians, consumers, genetic counselors, public health folks, and anybody else really that expresses an interest to be involved. We love to have them. We have actually been copied by a couple of the other regional networks. There was at least 2 other regional networks that were interested in implementing a state team model. So I think people felt that it was probably a fairly successful model and are duplicating it. We have added this year quarterly state team co-lead roundup meetings. And again, that goal is largely to continue the cross collaboration between the state teams so that we sort of know what each other is working on and take the opportunity to collaborate as we can and across those state lines. Each state team continues to explore projects specific to their state's needs. And so you'll hear more about those in the breakout sessions today. And hopefully those breakout sessions will be nice and interactive. The second older, quote unquote, program that we have going forward this year is the Genetic Ambassador Program. This program, I think, largely sort of started because we had such interest in our state teams that we had a lot of consumers who wanted to be involved in the state teams. And notably, the state teams to some extent got too large to be overly productive. So these genetic ambassadors, that program was started in the last grant cycle. These are largely consumer members who then help serve, help with projects, continue to serve as state team members and help with genetic awareness. And they individually have their projects that they work on as well. This program is pulled together a lot by Christy, and the Genetic Navigators meet quarterly in this new grant cycle. That's the plan. And so far they have meetings scheduled for July and, so I shouldn't say that. So far they had nice, very productive meetings in July and October of last year. And moving forward, there'll be quarterly meetings. Currently, the project that the genetic ambassadors are currently working on is called Red Flags for Genetics. This is a survey from a family's perspective of those red flags that prompted genetic evaluations. And this is one of the surveys that, of course, Christy mentioned at the very beginning. We have one in English and one in Spanish. And we hope that these get shared sort of far and wide. We will tie this information back into one of our new initiatives once this information is obtained and analyzed. So if you have a perspective and can participate in the red flag survey or know families that would be willing to, please pass these along. And then, of course, one of our other very successful grant cycle projects from last cycle is the genetic pop-ups. These are being continued. We are in that kind of first cycle right now. We have 8 so far planned for 2021. These were all planned around the February 17th through March 10th, kind of around the Rare Diseases Day. And we've had nice applications. And as you can see by the map, many of our states have 1, 2, or even 3 genetic pop-ups planned. As you recall, these are small group gatherings, usually initiated by somebody from the state team with the hope of spreading genetic awareness. So on to the new initiatives. One of our most exciting initiatives is one that we call Time for Genetics. This also was previously called the 40 Clinic Initiative. We have been working hard to kind of make exciting brands. And again, once again, thanks Christy for her ingenuity there. So we have identified 7 clinics. The idea is to have 1 clinic per state as a pilot this year, and then eventually 5 clinics per state, so that we have a total of 40. Some of the states have continued to identify their clinics. We have requested partnership agreements with the clinics. These have been sent out and hopefully due back by mid-February. Interestingly, we did also have to go back through the IRB process for some of the clinics to participate. That has been done, again, largely this time and last time by Liza and her team. And the Time for Genetics idea is a 4-part series, kind of one thing per month for 4 months. That includes initially a webinar of some topics. So for instance, here you can see topic 1 is the red flags for genetics. Again, this ties back into the genetic ambassadors survey that we just talked about. And then we have the next month is some sort of newsletter. The following month is some sort of family resources or resources for the providers, and finally a mailer, such as maybe a poster for the providers to put on their wall in their waiting room. The idea here is not a lot of work on the clinic's part. We're hoping for about an hour a month. That's what we've tried to let the providers know, so that we are not overburdening the providers. The first cycle begins in April of this year. And again, it's probably going to be the red flags for genetics. And then we hope, I think, to do developmental delay, utilizing the algorithm that was developed last time, and developing some new resources. And so hopefully tying some stuff that we did in last grant cycle to this grant cycle, and utilize the resources that have been developed over time. The other new initiative is Genetic Navigators. This is a new initiative that we hope to launch actually today. Again, applications open, as you can see. This is, we're looking for 1 individual per state that will become the state navigator, and the navigator will then help families navigate the genetic services within their state. So typically this would be someone that's been through the process. This is a stipend funded role and does have some training associated with it. So we're not just sending folks out without some background here. There's going to be 8 training modules. And again, the hope would be we get applications from individuals within each state and have a navigator identified for each state to help other families navigate the genetics evaluation. So here's that link as well. So if anybody's interested to apply for the Genetic Navigator program, or know someone that might be interested to apply for the Genetic Navigator program, here is that link. I think we're quite excited to be able to get this program rolling as well. Christy, once again, has worked hard on developing the agenda and the curriculum. I think this will be a really exciting program to see take fruition. And finally, one of the last main points that we're going to do this year, project, sorry, is new explainer videos. This sort of takes the place and is the next extension of our Facebook Live videos that we did in the last grant cycle. If you recall, we had Facebook Live presentations. We had done a survey, gotten topic ideas, and engaged providers across our region to do Facebook Live presentations on those particular topics. That was quite successful, we thought. And so this is sort of the next step that we thought we would try. And these would be sort of, as described, explainer videos. So we hope to take certain genetic topics that continually get explained. So from a clinical standpoint, you know, I don't know, autosomal recessive inheritance, autosomal dominant inheritance, what is a VUS? What is a gene? What is a chromosome? So very sort of basic concepts that I think those of us in genetics tend to explain over time, and that families and individuals trying to understand genetics need as a background to understanding what's going on with their children. So we're hoping that these explainer videos are an animated video that then describes these concepts sort of in easy to understand terms or analogies that can be put out probably, you know, on YouTube, or certainly made available to clinics so that they can be utilized for education purposes. Here is yet another link. We are trying to first survey the need out there. And again, we will not reinvent the wheel. We know there's also a lot of information out there on the web about that sort of does these sorts of similar projects that you can look at. But we would like to take a survey of providers, counselors, primary care physicians, pediatricians, nurses, anybody who tends to utilize this terminology as a starting point to say, what do we need to do? What would be a good starting point? What are the topics that we need to do? So here is the link for that survey as well. And please feel free to pass it around. So those are our big 6 initiatives. I probably did them a little faster, so I guess we're starting out ahead of time. But if anybody has questions or concerns, please put those questions in the chat box. We're excited to get these projects rolling, and you'll see a lot more about them as we move forward. So thank you.
Thank you, Janet. We appreciate you doing the big 6 overview. We'll show you how those all tie together to our genetic gasp here shortly. You have us ahead of time, so thank you, Janet. And we are going to switch to Soon-Yun Kim, and I would like to give her introduction. Soon-Yun is a public health analyst with the Division of Services for Children with Special Healthcare Needs, where she primarily works with genetics and newborn screening programs. Prior to joining HRSA in 2019, she had worked at the State of Alaska Division of Public Health, supervising public health centers and community and regional health projects, and providing safety net public health services. For those who have been with Mountain States and the collaboratives and the network for a while, you may remember Jill Sugar, who is our grant officer for HRSA. Soon-Yun is serving in that role now, as that Jill used to be in, and we are just thankful for both of their leadership for the work that we do here at Mountain States. And with that, I will turn it over to Soon-Yun to share her slides and give a presentation from a HRSA perspective and overview.
Thank you, Christy. I'm going to start sharing my slides here. Are the slides showing up? Perfect. All right. So good afternoon, everyone. You know, it's my great pleasure to be here today. As Christy mentioned, this is my first Mountain States Regional Genetics Network kind of large meeting. So it's exciting to virtually meet you all. And as she mentioned, I'm the project officer for the HRSA's Regional Genetics Network, or RGN program, which, as you know, funds the MSRGN. And today I briefly wanted to provide some overview info on the RGN program and what we look forward to for the next 4 years in the new cycle. Just a quick recap of who we are and where we fit. Health Resources and Service Administration, HRSA is one of several operating divisions under U.S. Department of Health and Human Services, and we really aim to provide healthcare and improve health outcomes. So within HRSA, there are 16 bureaus and offices. MCHB has a specific mission focused on mothers, children, and families. You may have seen or heard about this before. Under the leadership of Dr. Michael Warren, our MCHB Associate Administrator, our Bureau has been approaching our work with this Accelerate Upstream Together paradigm. So while there are a lot of advancement and achievements in the field of maternal child health, much more work remains to be done, where we must accelerate our change of pace to improve health outcomes and eliminate health disparities. And in order to accelerate, we must look upstream at primary prevention, where we prevent things, from it happening. So for public health folks, we often use this river analogy where, you're walking by a river and you see a drowning person float by. So you jump in and rescue this person. A few minutes later, you see another person, you go rescue that, and another, and another. And at one point, you might want to go upstream to look for why people are falling into the river in the first place and fix that underlying problem, rather than spending all of our time and energy to keep drowning people over and over. And in improving health outcomes, we also recognize that that requires us to consider factors beyond clinical care that affect health, such as social determinants, and looking at the whole life course of an individual. So finally, for us to accelerate upstream, MCHB needs to do it together with our state and federal partners, non-governmental organizations, local and community partners. So in other words, all of you, and put our populations we serve front and center. And so again, we use and apply this paradigm to plan and drive our work, including our genetics programs. So MCHB has several different divisions, and I'm with the Division of Services for Children with Special Health Needs, or DSHN. About 1 in 5 US families has a child or youth with a special health care need. And the mission of our division is to provide national leadership to expand and strengthen access to a system of services for this population and their families. So I'm not going to go into too much about this diagram, but it shows what a well-functioning system of services should look like, and the 6 core components or outcomes that we have been promoting through our division work for the past 2 decades. We are actually currently in the process of developing a blueprint that will identify priorities and opportunities for focus to better support children and youth with special health care needs, and how kind of that impacts the 6 core outcomes that I have here. So more to come on that once the blueprint is ready and final to be shared. So our division has a diverse portfolio with a number of programs and activities that we fund, some of which you might be involved in as well. All the programs activities can roughly kind of fall into these 14 major programs, and one of which is the genetics program. So I would imagine that some of you have been part of MSRGN since the beginning, or even before these regions existed. So you might know, but since 2004, HRSA has funded what back then was called the Regional Genetics and Newborn Screening Collaborative to provide leadership to expand, strengthen, and evaluate access to a system of genetic services. In 2017, so our last cycle, the program was reorganized to the current iteration with really a heavy focus on linking underserved populations with genetic services. So the current portfolio includes these 3 programs that are really designed to work together to our end goal of improving access to genetic services. These colorful slides are a bit busy, but they outline some of the main priorities of the 3 genetics programs and how they align and kind of work synergistically. The structure of the 3 programs and the priorities have remained pretty much the same since the last cycle. So the Regional Genetics Network funds 7 regions across the US that supports regional infrastructure. And I'll go into the priorities a little more in the next few slides. And then the advances in integrating genetics into clinical care that funds the National Coordinating Center for the RGNs that support and provide TA to the RGNs, but also, serve as a national resource for, policies, creating resources, informing about legislation, and et cetera. The National Genetics Education and Family Support Program also provides TA and support to RGNs with primary focus on family engagement, leadership, and genetics education. So for the RGN programs, again, as I mentioned, the priorities have remained pretty similar as from the last cycle. One of the main priorities for this program is to support a regional infrastructure to the genetic system care delivery system. So, really the design and priorities have kind of remained similar, so that with the intent and hope that this cycle will build off of the work that has been done over the last, not only the last 3 years, but the last 2 decades. So really continuing to strengthen, build, and expand partnerships and relationships. And and kind of looking at, within the region, MSRGN knows the Mountain States region the best. So really looking at who are the underserved populations, how do we connect them to genetic services, what are the mechanisms, and how well are they working? And the state team, as Jen mentioned, I think have done phenomenal projects and work over the last 3 years. And I'm also looking forward to hearing more about what's going on over the next few hours and over the next few years. Another big priority is to provide education to providers, families, and other stakeholders. So again, kind of building off of, there have been a lot of resources and trainings and education that have already been done. Building off of that kind of resource repository and creating additional materials and implementing that to inform families about kind of what genetic services are out there and helping them to get there. Also helping providers, especially our non-genetics providers, to connect them with genetic system care. And then again, with the pandemic, telehealth has become kind of everyone's go-to in terms of healthcare, but RGNs have really done a lot of work around telehealth in the genetics healthcare delivery system over the last years. And, we want to continue to support implementing and facilitating integration of telehealth, again, with the hopes of the end goal of improving access to genetic services. And fine, so I think Eliza is going to actually go a lot more into program evaluation and objectives, but I just wanted to kind of note, these are the program objectives, performance measures that the MSRGN will be striving towards through this cycle. And it's kind of, again, these performance measures, so they, RGNs report the performance measures to the National Coordinating Center, but also they provide additional reports, both qualitative and quantitative, through their progress reports. And all of this information really helps us kind of answer some of the questions of, are we on track with the plan and implementation? How's the quality of the work? Are we seeing improvements in outcomes and access to services? Are we focusing on the right things? Are we making an impact? So, these measures that you help collect and report to MSRGN allows really the team and us on the HRSA end to inform and manage the work, but also helps us kind of tell, especially the performance measures that are kind of standardized across the 7 regions. It really helps us to roll up to tell a national program-wide story of what the RGNs are doing across the nation and the impact that they're having on the system, and how the RGNs are doing over time now that we're in year 4 of collecting these measures. So looking at the 7-year span, how the measures look different and what kind of improvements have been done. We also utilize all this information to answer to our stakeholders, with our federal and non-federal partners, demonstrating, what the RGNs are doing, what you guys are all doing, and also sharing what has been done on certain areas like telehealth, or working with tribal population or specific areas, kind of looking for collaborative opportunities and sharing resources and what's happening. And as stewards of federal funds, we also utilize all of these measures and information to help us provide updates and information to our funder, our Congress, through congressional reports or any other information inquiries that we receive about the program. So all that said, we really appreciate all the work that you guys do to kind of think through the measures and collecting them and reporting and all that work that goes into it. Just really quickly, these are some of our newer websites. We have our HRSA Clearinghouse Information Center around newborn screening that is live now. That's sort of initial phases that we're going to continue to build and add resources to. We also have our HHS telehealth site that's supposed to be, that also will serve as a central repository for resources around telehealth for both patients and providers. So please feel free to utilize these resources and help us spread the word. Just wanted to make a quick note that we have our next advisory council committee on heritable disorders of newborns and children on February 11th and 12th. And if you guys are interested in attending, the registration link is on the slide. And that brings me to my contact information. If you guys have any questions about anything that I've shared or to reach out, this is my contact information. And HRSA also has various social media outlets and also send out regular newsletters. So please feel free to sign up for any of those and connect with us if you haven't done so already. Thank you. I know I kind of rushed through everything so that we don't run behind time.
Thank you, Soo-Yun. We appreciate it. Great overview. Thank you for that. All right, I'm going to shift gears now and tell you guys all about the genetic gasp. So I'm going to share my screen here again. Thank you, Soo-Yun. And I know you all are wondering, what does GASP stand for? So GASP stands for Great Point, Aha Moment, Smart Thought, Pertinent to my life or job. And it's our attempt today to have you all think about, as you're going through the day, going through the next couple of hours, what some of these might be for you. If you have an aha moment, we want to capture that. If you think someone had a great point and you want to remember it, we want to capture that. If you hear somebody tell something that's pertinent to your life or job, we want to capture that. So how are we going to do that? We have a new tool to try out. So I'm going to do a little demo here of that. And let's see, share that with you. The inspiration came from my daughter's virtual online schooling. So welcome to Padlet. I don't know if any of you have played around with this before or not, but this is our virtual bulletin board for the day. And all of these colored boxes are really just sticky notes. Think of them like sticky notes. And so we want to use this bulletin board to capture our genetic gasps over the next couple hours. It's fairly easy to use. I'm going to do a little demo. This pink circle down in the lower right-hand corner has a plus in it. When you have a gasp, you click the plus and a box pops up. You can type your name if you don't mind sharing who you are. If you want to be anonymous, you're welcome to type your avatar, Mickey Mouse, or anyone else that you might pick, and then record your gasp here. Sorry. And when you're done, just click anywhere else and it will post. And this is live and interactive. So as you're posting yours and other people are posting, your screen will update with other people's gasps. Once you post it, once you click outside of it and it's posted, if you would like to, if it has to do with one of the colored boxes at the top, for instance, what if perhaps it's a gasp about the genetic pop-ups and you'd like to color code it? If you click these three dots, when you hover over your post, you have three dots there. You get some color choices and you're welcome to color code it if you'd like. If you'd like to keep it just white, that's okay. We're going to be able to capture all of this and download it after the meeting. So we'll categorize it for you if it's not about one of the top 6 things that we've talked about that Janet highlighted, that's okay. It can be just a general comment as well. But if you'd like to play around with it as we go through the meeting, we hope it will be a great place to really capture our thoughts as we're going. And we'll post the link numerous times. I'm going to ask Stephanie if she'll drop the link now into the chat so that everyone can have access to it. And again, when you have a gasp, just click that pink button, and a box will pop up for you to type in. And I just wanted to just give a little bit of other explanation for some of the things up here. These top boxes, as you might recognize, correlate to the top 6, the big 6 that Janet talked about. And some people were asking for links and where links posted. For instance, the red flag survey, if you click the little comment box, the links to the surveys are linked there. The pop-ups takes you to our website for the pop-ups. The Genetic Navigator program application is linked there. So if you're looking for any of those are in the comments at the top. The other great thing that you can do as you read other people's gasps is you can rate them. You can give them some stars, some likes there as well. And you can also comment on their gasp if you wish to leave a comment for somebody else's gasps. So we hope that you'll enjoy this. As I said, we'll remind you throughout the meeting to record it, but it would be really amazing. We have 83 participants online right now. It would be really amazing to have 83 sticky notes by the end of the day with a thought from everyone, or even more. So thank you for playing along with us. And with that, we are ahead of schedule, which is really exciting. So that means that we get a little bit extra break, I think now. And we are going to start our breakout sessions right at the top of the hour. So I just want to let you guys know everybody's pre-selected breakout sessions when you registered. And so with the magic of Zoom, you're going to be teleported into your breakout session room about 5 minutes to the top of the hour. So when you come back to your computer, you will be in your breakout session room for the state teams that you have picked. First up, we have Colorado and Wyoming, Colorado in room 1 and Wyoming in room 2. So I'm just going to give a verbal reminder for the Colorado team and the Wyoming team who is presenting to go ahead and get their slides up during the break, because right at the top of the hour when we return, we will go ahead and get started in our breakout rooms. But thank you for sitting through the first section, and everyone can go grab a drink or a snack or a potty break, and we'll see you right at the top of the hour. Hi, everyone. Are we coming back? Everybody's almost back here from all our breakout rooms. I guess seeing the thumbs up, Katie.
We've still got some folks that haven't made it back yet, but everyone will be brought back in 15 seconds if they haven't already come.
Okay, I'll wait for your thumbs up and then I'll introduce Liza.
Okay, sounds good.
Liza, you're good with your, ready to share?
Should be sharing.
There you are. Thank you.
All right. Looks like everyone's back.
Thank you. Thanks, Katie.
Yep.
All right, welcome back to the main room. I hope you all had fun in your breakout sessions. I know we had a good time in room 1. It is my distinct pleasure to introduce to you all, many of you know her. She sat in this chair before I did and was the gal that I picked up the phone and called when I was a lost parent at the beginning of my journey. Liza Creel is our evaluator. She is also an assistant professor at the Department of Health Management and Systems Science at the University of Louisville School of Public Health and Information Sciences. That is a mouthful, but she's also MSRGN's evaluator. And so I will turn it over to her. She's going to tell us about the evaluation overview and performance measures. Take it away, Liza.
Thank you. So I do have a long history with Mountain States, and I now work at an institution with a very long name. So sort of the theme of the day. I have been allocated only 15 minutes, which isn't nearly enough for everything I would want to tell y'all about today, but I'm going to do my best. So I'm going to introduce our team here at the University of Louisville and then share with you some progress that Mountain States has made over the prior 3 years, and then talk a little bit about our evaluation plans moving forward. So you might wonder why there's a person from the University of Louisville talking to you, all of you in 8 states in the Mountain West. We do have mountains, of course, in Kentucky, but are not part of the Mountain States region. But myself and my colleague, Maddie Shipley, are very closely tied either geographically to your region or in our desire to improve access to healthcare services for underserved communities. So Maddie Shipley is an MPH health policy student in our school. She's also a graduate research assistant that works with me on this project. She's originally from Wisconsin and went to college in Iowa and very much appreciates the unique challenges of delivering services in rural communities, obviously something Mountain States as a regional genetics network is focused on. She also is very passionate about maternal and child health issues. I literally have my heart is in Texas. That is where I'm from. I was raised in West Texas and obviously have a long history with Mountain States as well. So let's talk a little bit about the evaluation and sort of our approach to evaluation in Mountain States. So there's really 2 major components of our evaluation. This was true in what we refer to as the prior grant cycle, years 1 through 3, everything that just ended last May. This continues to be true in the cycle we're in currently and as we move forward. But let's talk a little bit about how our evaluation is structured. First, we have something that I'm going to refer to and you've already heard about called the program objectives. These are defined by HRSA and are outlined in the funding announcement. You can sort of think of these as a lens through which all the Mountain States RGN activities were planned. These are the program goals that HRSA has laid out for the RGNs to achieve. And we'll talk about what some of those are in a minute. Second, there's something we refer to as the performance measures. These are what we use and what all the RGNs, along with the National Coordinating Center and HRSA, collectively developed to measure annual progress toward those program objectives. So these 2 things are interlinked and closely related. So I'm going to start with a summary of a few performance measures and the data that we captured and monitored over the last grant cycle, so years 1, 2, and 3. I don't have time to present everything I'd love to present to y'all today. We're also finalizing some of the year 3 data, but I'm going to share with you a few selected outcomes that were measured using these performance measures. If you are interested in more detail or information about other things that we've looked at, I'm happy. Like I said, we're finalizing year 3 data, and I really anticipate that some reports on this should be available soon. But here's one of our performance measures. It looks at the number of providers and individuals and families that received education or training on genetics from MSRGN. So here you can see 3 lines. The blue line is the number of individuals and families served. The yellow line is, educated or trained. Yellow line is number of providers receiving education or training. The green line is a sum total of those 2 lines. So what you can see is that over years 1, 2, and 3, we saw an increase in individuals, either professionals or providers, and individuals, meaning patients and families who are receiving education and training from Mountain States. This slide shows some website and social media statistics. And this is important because both the Mountain States website and the social media platforms that are used are ways that MSRGN disseminates resources to stakeholders. So again, we see increases over time. Of course, YouTube videos were 0 in year 1 because Mountain States wasn't using YouTube at that time. Through some of the projects that were initiated, including the Facebook Live program, we saw an increase there. Can also see a fairly substantial increase in Facebook engagements and website hits over time. Much of that is a credit to the state teams, of course, who in years 2 and 3 were really building their state team pages as well. Another performance measure that we look at, and all of the regions look at these, all 7 RGNs measure these exact same things, is the number of patients for whom a regional genetics network facilitates connections to a geneticist or to genetic services. So this slide shows those data for Mountain States. In year 1, it was relatively low. Year 1 was kind of a get off the ground year, much like we're in right now. In year 4 of the news, or year 1 of the news cycle, year 4 of this entire program. But you can see a fairly substantial increase here. Much of this is related to the activities of the state teams. In years 1 and 2, the New Mexico state team was doing some assessments with families and making referrals for services that were identified as needed. We have the Utah state team who developed their developmental delay algorithm and implemented that in a couple of pediatric practices. We also had the Underserved Populations Project, which really, all of those focused on doing just this, facilitating connections to genetic services. Expanding telehealth, as many of you know, or expanding telegenetics has been a goal within MSRGN for some time. It's certainly a priority at HRSA and in all of the RGNs. We look at telegenetics in 2 ways in this evaluation. First, where are people getting telehealth services? And that's what you're seeing on the slide in front of you. This is the number of sites, so physical locations where telehealth is delivered. It's where the provider sits along with where the patient and family sits. So what you can see here is that there was a substantial, I think if I actually ran some statistics on this, it would be a statistically significant increase in the number of telehealth sites from year 1 to year 3. And you may be wondering, my goodness, what happened? What did Mountain States do that we haven't heard about yet from year 2 to year 3? And this increase is entirely attributable to COVID and the transition in March of 2020, where many patients were going to, let's say, a public health clinic in their community or in the community next door, and they would get the telehealth visit at that place. Due to COVID, a lot of those places were not open, and so many telehealth visits were actually occurring in the patient's home. And we are capturing that here. That is not, we can separate those data and look at which are these physical office locations where a patient might go and which are really those home sites. And so you can see kind of the breakdown there. We had 24 no change from year 2 to year 3 in the number of office sites that were available for telehealth, but a major increase in home sites. The other way, of course, that we look at telegenetics is by the number of patients who were served using telegenetics in MSRGN supported clinics. We also see an increase here as well. So remember I said that these performance measures help us monitor annual progress toward these overall program objectives. So I'm going to give you a breakdown of where Mountain State stood at the end of the first cycle in meeting the original program objectives. The first was that the RGN would serve 250 individuals after their first year. So by the end of year 1, Mountain States did not meet that, but was made it almost more than halfway and served 129 individuals in that first year. Looking at individuals and families served across the cycle, also not met, but very close, 1,274 individuals and families served. There were other goals to increase the number of medically underserved patients that were served by the Mountain States RGN. That goal was met. We were tasked with a 20% increase and achieved a 420% increase, so far exceeding that program objective. Again, increasing the number of clinical sites that use telehealth. This objective was also met. And exceeded. Same for serving medically underserved patients through telehealth with an over 275% increase. Finally, the last cycle focused extensively on increasing resources available to and used by primary care providers. This goal was also met. We measured this in 2 ways: the number of primary care providers that were participating in MSRGN education and training activities. There was an increase there. Separately, we looked at the resources that were made available on the MSRGN website, just on primary care specific web pages, and looked at website hits and interactions on those web pages. That was also, we also observed an increase there. So now we're in, right, that's sort of what has been happening. And then we've now moved into this new grant cycle. And you may kind of be wondering why you see years 4 through 7 there. And I just want to mention that this new cycle is really visualized as an extension of all of the work that began in the prior cycle, as we've commonly referred to it. And so we have started using a notation of, in the evaluation work at least, of years 4 through 7. And this is important because we actually have baseline measures. You know, we're measuring things like percent increase, so we have to know where we started. And our baseline data and measures are actually from that first cycle. They would have always been year 3, the final year of that first cycle, but COVID made that a very complicated baseline measure and value because it changed so many things. Sometimes it made numbers higher, sometimes it made numbers lower. So there's been a collective decision across the NCC and HRSA that the baseline year for all of our metrics moving forward will be year 2 of the prior grant cycle. But again, we have these overarching program objectives that help us guide us and plan programs and projects to meet those objectives, and then the performance measures that we look at year by year. These are the program objectives. You've already seen these on Sue Yun's slide, so I won't repeat them or read them at least. They're very similar in lots of ways to what our objectives were in the prior cycle, but there's some unique kind of differences in language here. First, the facilitated connections, it used to say facilitate connections to a geneticist. That's been presumably broadened a little bit, although we're having some discussions about this, to facilitated connections to genetic services. Then also, as you may recall, there was an emphasis on primary care providers gaining access to resources and receiving education and training. That language has been broadened a little bit to healthcare providers. We will, before I go to that last slide, I just do want to mention the performance measures that I reviewed with you all with some data from the prior cycle. We plan, and all the regions plan, to continue capturing, collecting, and measuring those same performance measures. So what we've been doing so far, we've spent a ton of time with your Mountain States leadership to strengthen documentation and monitoring systems that support our evaluation, so that we are more systematic in how we're documenting what you all are doing and the outcomes you're observing through your work. It's taken a ton of work, but it's going to pay off for us in the long run. We are continuing to collect data, collaborating, of course, with the Time for Genetics partners and the clinics that you all have been identifying to streamline data collection and reporting and make sure that we're doing things that make it as easy for them as we can. Working with Christy on an outcome, thinking about outcomes for the genetics pop-ups, of course. And then something you might have heard about is the state team case study. Because Mountain States was the first to do the state team model, we really want to document that. And we had planned to start a case study talking to many of you last spring, and COVID came and it disrupted all of our lives in many different ways. And then we obviously had the start of a new grant year, but we anticipate starting that in the calendar year 2021, and as soon as we are able. That is all I have for me. I think I'm right at time. I knew there would not be time for questions, so my email is on here, or I'm happy to chat responses to questions in the chat box if there are any.
Perfect. Thank you so much, Liza. And this link that she has on the bottom is on today's event page under the slides category, if you want to see the performance measures. With that, I'll ask you if you can stop sharing yours. Thank you. And we'll let Megan pull hers up. And while she's doing that, I'm going to introduce to you all Megan Lyon. Since 2013, Megan has worked with the American College of Medical Genetics and Genomics, and in her current role as Senior Program Manager for the National Coordinating Center for the Regional Genetic Networks, she supports collaboration and activities between NCC and the 7 regional genetics networks and the Family Center. From the George Washington University in Washington, D.C., she received her master's in public health and health policy and a bachelor's of arts in psychology and political science. And we are so pleased to have you with your wintry background. Thank you, Megan, and I'll turn it over to you.
Thank you, Christy, and thank you to Mountain States for inviting us to speak today about our resource repository, which we affectionately call RERE. That is what we'll be saying throughout the presentation. So as you've heard throughout Mountain States presentations and from HRSA earlier this morning, NCC works with the 7 regional genetics networks and the National Genetics Education and Family Support Center to improve access to genetic services for underserved populations. As with Mountain States, that takes different forms depending on our focus areas. But one of the ways that we try to build partnerships and encouraging of sharing of resources between not only us as regional genetics networks and NCC and the Family Center, but with our national partners such as the Telehealth Resource Centers, the Catalyst Center, AAP, ACOG, all of the national organizations, we have developed what we call the resource repository. So RERE has over 400 plus resources in it to date. And as you can see, based on the topics and intended audience, it's a very wide range of information that is listed in RERE. And the intention of RERE is really to share tools and resources that can be used by the genetics community. So some of the resources may not be specific to genetics, like we have a lot related to telehealth. That is developed by the Telehealth Resource Centers and their national center. While it may not be genetic specific, the information is very valuable and can be utilized by the genetics community. And so we have quite a few resources, and we break it down in multiple different ways, which I will now show you on our website of how you access it, how you can find information, skip ahead, and how you can learn more and add resources to RERE. So you can visit our website at nccrcg.org, and on the left-hand side, you'll see resources. So if you click on that, you open our resources tab, and the resource repository lives right on this page. And so the first thing I'll call attention to is we break down by 2 different categories the resources that are in ReRe, by topic and intended audience. As you'll see when I open up the resources, there's more information we put in about the specific resource, but those we found are the 2 areas people are most interested in learning about. It's either by a certain topic or by a specific audience that the resource is targeting. So I will come back to the resource notifications and submitting a resource and show you how ReRe works. And so this is the view on our webpage, but I'm actually going to go to the larger view just so you guys can see a little bit better what ReRe looks like. So once you open ReRe, you'll see that there's quite a bit of information per resource. So if I click on one, it's what to expect from a telehealth visit. So it lists the name of the resource, who developed it. This happened to be Western states, the topic or topics that the resource covers, who the intended audience is. And the key part of how we've developed ReRe is that it is URL based. So the resource itself does not live within ReRe. So that ensures that when updates are made by whoever developed the resource, that our links and our information is up to date as possible. We do a review every 6 months of information to make sure like a link just didn't disappear or didn't break. But our intention is that we just want to be an aggregator of information, and we want to be able to send people to the institution or the organization that developed the resource. So the resource URL can be found in the resource repository card. Then we also have some more information about type of resource, the date it was created, a short description about the resource. We're now starting to list if the resource is in English or another language. So there's a long list of languages that we have resources for in the repository. And then for some resources, for example, the Family Center held a webinar with the Heartland region in early 2020 that was walking individuals through a guide that was created. So we're able to tie together the webinar that discussed the guide so you can find related resources if we have them in ReRe listed here. And so that's what each individual resource card can show you. So other key features about ReRe that we really enjoy are the ability to filter information. So as you can see, we obviously are collecting a lot of different variables for each resource. But say you wanted to find resources developed by Mountain States, you could click it and it automatically filters out all of the other resources, and you can see what's in our repository related to Mountain States. And then say you want to know, I want to know what when the resource was added to ReRe. So you can do date created and do it based on when it was last added, or most recent or least recent resource. So there's a bunch of different ways you can modify how you look at this data. So if you're looking for also, you can add, say, let's do a topic of education. You can add that, and again, it will further filter the data so that if you're looking for something very specific, you can find it. Say you don't know what you really are looking for, but you kind of think, I want to know more about telehealth. So you can just search telehealth over here with the little magnifying glass, click enter, and you can see that there are 72 results. And so you can just go through and see all of the resources, and you can see that they're being highlighted as we go through the list to find resources, and it searches for any information within that record. So it's not just searching on the title, it's searching on anything within the record. So that's an overview of how ReRe works. There are 2 other things I'll note about how you can interact with ReRe. So you can also, if you would like to, we can send you a notification when a resource is added to ReRe. So you can click here and you'll go to the survey, and you can say you want to be notified when a new telehealth resource is added. Or you can say every time you add a resource to ReRe, I want to be notified. So it's hopefully a very simple form for you all to fill out if you would like to be notified by email about a new resource. One note is just how our system is set up. We can't say there are 3 resources added in a day. We can't aggregate those into one email. You would get 3 separate emails. That does not happen that often. We always review the resource before we add it, make sure it's coming from a trusted source. It's usually from the regions or another government funded or national or regional organization that we work with. But that's just one note for you all to know. And then lastly, we always are looking for other resources we're missing. We don't think that this is a full list of every resource that could be relevant to you all. So you can go through and fill out our form and we'll approve it to get added to RERE. So I see that there's been some chat. Are there any questions that I missed, or was it not related?
So Megan, I think the first one was in response to Liza's evaluation, and then sharing the links to RERE and the other NCC resources. And then Christy put up the link for Padlet if people want to add in genetic gasp to this. And Janet just asked a question.
Yeah, thank you so much, Stephanie. Yes, so Janet, the resources are vetted by NCC, and it's, again, we look at who developed the resource, and it is mostly organizations that we partner with. Again, if individuals want to add a resource that has nothing to do with our system, so outside of the regions and the National Coordinating Center, they can absolutely fill out the form. But if it's not a relevant resource, we won't then add it to RERE. And so I see there's also a question about upcoming webinars. So we actually have a calendar that is separate from RERE that you can absolutely add upcoming webinars to, but we do not keep upcoming events in RERE. If it's a recorded webinar that is stored on, say, Mountain States or on NCC's website, we would add it to RERE. So then I'll just quickly switch. Yeah, go ahead, Christy.
So Megan, I was just going to say, in our breakout session, there was a question posed about how can we not reinvent the wheel with all of the resources that we are developing in our state teams. And I did a plug for this because I told you that you should rename the presentation to How Not to Invent the Wheel, Go to RERE First. Go ahead.
I really like that. I think that's a better title than the one I had, admittedly. And so one last thing before we wrap it up in NCC, Mountain States was gracious enough to allow us to put information about our upcoming Public Health Genetics Week. So NCC, in partnership with the regions, HRSA, CDC, NIH, APHA, NSGC have started a Public Health Genetics Week. And so this will be our 2nd annual Public Health Genetics Week. And the goal of the week is to increase awareness and to celebrate the field of public health genetics. And so we would love your participation in the week. There will be a lot of information coming out over the next couple of months about different events that will be occurring. It is a social media online awareness campaign, so everything will be done virtually. So if you have any questions, please feel free. You can email me, or you can visit. There's a specific website just for Public Health Genetics Week, phgw.org. But you can also email me at my email address, and we look forward to you all participating in Public Health Genetics Week. Thank you so much.
Thank you so much, Megan. I really enjoyed being part of that work group last year and this year. And thanks to our Nevada team for participating last year with their careers in public health genetics. And so thank you for showing us all about RERE as well. All right, with that, my favorite part of the day, we get to play trivia again. So I'm going to share my screen. And for those of you who jumped on early, you got to do this a little bit already. To practice using your chat, but we're going to use the chat box again. And I will put up the next question. So get your fingers ready. And here it comes. Which state is home to almost half of all the wild horses in the United States? Your options are Utah, New Mexico, Nevada, or Arizona. All right, let's see. I've got a Wyoming, that's not an option. I've got a Nevada, Let's try that. All right, 100 points, and that was from Mitch, and Mitch is from Nevada. So let's find Nevada here and give them 100 points. Great. All right, next question. Question 2. Which state, excluding Alaska and Hawaii, has the coldest recorded temperature in the country? These are your options. Man, you guys are fast. Okay, I've got a Montana. Yeah, all right, 100 points goes to Montana, and that answer was from Jen Bana, who lives in Montana. So Montana gets another 100 points, and I think they might be in the lead. Yes, all right, so let me put up a question 3. And here it comes. Which state holds the record for the largest gathering of people dressed like gorillas? And the choices are Wyoming, Arizona, Colorado, or Utah. No Texas, Colorado. Let's see, Melissa says Colorado, 100 points. And I believe, Melissa, you're from Utah, correct? I think. Yes, all right, so those points go to Utah. All right, and let me put it in a Q4 here. All right, which state is the only state to have each county contain a part of a national forest? Arizona, Utah, Wyoming, or New Mexico? Got a Texas, not an option. Utah, Heidi says Utah. 100 points, those go to Utah. Heidi's from Utah. All right, and question 5. Which state holds the world record for most selfies in 1 hour? The options are, I lost there we go. Heidi says Utah. Oh, our first no, okay. Melissa says Utah. Christopher Tiffany says Nevada, that's not up there. New Mexico is not an option. A for Texas, Debbie Bridge, nope. Robin Palmer says Colorado. And the answer must be Arizona. And unfortunately, no one gets any points for that one because they deduct as you go down. So there we go. We have 2 winners. Congratulations to Montana and Utah for winning our trivia game. Thank you, everyone. All right, I'm gonna stop sharing now and just let you guys know that we are at our next break. But before we go, I want to let you a couple reminders. We ask that you could please stay logged in. So just turn off your audio and turn off your video, but stay logged in if you don't mind when you do take your break, so we don't have people coming back in the waiting room. And then we are going to go now after break, we will have the teleportation happen again at about 1:15. And you all have been pre-assigned based on what you chose during registration. Katie will be in the main room to assist if anybody needs to switch rooms. But we will get started promptly at 20 minutes past the hour, and Texas will be up in room 1 and New Mexico will be up. So just a reminder to the Texas co-leads and New Mexico presenters. I think Sandy's presenting for New Mexico, and Melissa and Daphne possibly for Texas, to have your slides up and ready. So when you get transported into your new breakout session, you'll be all set to go when we come back. So with that, I will let you guys have a little extra time. Please, we're gonna pop the GASP URL in the comments again. So take a couple of minutes on your break and reflect on what you've heard in the first breakout session and the presentations from Liza and Megan, and write some GASPs on there, things that you want to remember and take away. And with that, go have a bio break, get a snack, and we'll see you back at 20 past the hour. forming an MSRGN work group to develop interstate networking for providing clinical genetic services, particularly for low resource states, and address solutions for overcoming challenges and barriers. He shared in our session that there was a year wait for some folks in their state, and up to a 3-year wait for others. And so he was really concerned about that. Ivy has one that we can connect with our Act Early ambassadors. One is her coworker. Great. Winton said, love today's sessions. Grateful and thankful for all that you do. Be well. Thank you. Melissa had a great resource today, and an aha moment with some key search words to find some information. That's always helpful, right? Knowing what to put into Google. Great. And then Lourdes says, awesome conference. Great. Ivy likes the birthday cake idea. Advocacy through patient stories about how and why access to genetic services is important are vital aspects of achieving change through legislative action. Great point. So with that, I'm going to stop sharing the Padlet. Keep posting. I see them popping up everywhere. So keep adding. If you, just as a refresher, just add that plus and you'll get a box where you can type your information. But with that, I'm going to stop sharing and just go back over to our PowerPoint here to wrap up with a reminder that we have a genetics evaluation link that's going to be dropped in the chat box. We really encourage all of you to fill that out. Your feedback is imperative for future meetings. We're still in the decision-making process of whether we will be in person or virtual for our genetics summit in the fall. So your feedback from this meeting will be helpful for our decision with that. And Liza, thanks you greatly for providing the data we need also through the evaluation. So thank you for doing that. That should be popping up in the chat there. And then some next steps. Just want to remind everybody about all the surveys that we've launched. So we have the red flag survey available in English and Spanish. If you go to the Mountain States webpage, the homepage, which is www.mountainstatesgenetics.org, you will see those at the top of the news feature there. I have posts for the red flag survey and the explainer video survey. So you can find both of those there. And then if you are interested in the Genetic Navigator program and applying for your state as a family member who has navigated genetics in your own state and would like to apply for that role, that can be found under the For Families tab under Genetic Navigators. The application is there too. All these links are also on the Padlet at the top. So you can go there as well. And I would be not a good social media person if I did not remind you that we are on Facebook and Twitter. And so please, if you have not followed us or liked us there, to do so, because all of that, as you saw from Liza's beautiful graphs, is information that we report back to our funders. And so we would appreciate a share on those to let other people know who Mountain States is and what we have to offer. All right, and with that, I'm going to peek at the chat and see if there are any questions, comments, anything else that anyone would like to share before we wrap up today, and ask Janet and Kathy if they would like to have any parting thoughts in the last 5 minutes.
So this is Kathy Hassel, and I just want to say I hope that this meeting was helpful for you today. Jan outlined our program objectives. You heard from our national partners. I know it was a whirlwind tour in Zoom. We didn't want anyone to get sores on their bottom or get too restless, but hopefully you've had a chance to see the nuts and bolts of what we're hoping to achieve in these next several years. And let me just say sincerely, we recognize that the backbone of our region and the work is really coordinated by and conducted by and identified by, and our people are served by our teams in each state. And not intended to be a pressure like, oh, we sit back, drink coffee and wonder how you're all doing. We're here to support as a regional infrastructure. We're here to let you know about resources from a national level, to feed up all the good work that you do, to be shared across the nation. And while this was a quick whirlwind Zoom tour necessitated by a pandemic, we look forward to meetings in the future where we can spend more time sitting around the cup of coffee in hand, some treats, to really further discuss and share. And in the meantime, we'll try to continue to provide other opportunities with monthly meetings, the roundups, as Christy has described them. I think we just can't say enough how much we recognize completely the backbone that you guys represent on the state teams. And it has been recognized as a model and as being, as Christy has said, copied in other regions. And so you guys are truly pioneers, not just on behalf of the patients and their families and the genetics community, but for the nation who tries to serve them. So I just want to say thank you very, very much, and for coming today.
Thank you. We truly applaud all of you. Without Mountain States, without you, we would not have Mountain States. So thank you for coming together today, and we appreciate all of you and all of your work and toughing through meetings like this in the midst of a pandemic. We too want to be back in person sooner rather than later. Janet, do you have any parting thoughts?
No, I was just gonna thank everybody for attending. It was wonderful that we had such a crowd, and echo what everybody else has said, particularly what Kathy just said, but also very thankful to our MSRGN management team, the people behind the scenes, Cody, Stephanie, Katie, Christy as well, Sherry, everybody that helps put this together. Big thanks to you guys as well. So again, thanks for everybody attending.
And we are again ahead of schedule. I don't know how we did it, but we did it with 2 minutes to spare. So we'll give everybody an extra 2 minutes back in their day so they can go, you can go record your genetic gasp and do the evaluation. I saw a couple of comments about the evaluation. I think they've got that fixed now, making sure that Montana was in there. Sorry about that. But thank you for bringing that to our attention. So I think the evaluation link is fixed now and the Padlet's up. So we'll keep that up for a day or so, collecting everybody's thoughts. And then we're going to download that and try to synthesize that, that information and data. So thank you all. We'll be following up with an email to everybody that attended with lots more links from today. So if you're having trouble finding links to any of those surveys, those will be coming. And we appreciate all your help in advance for sharing those. We're hoping to keep the surveys up through mid-March till our pop-up season has ended and the Genetic Navigators application is due March 1st. So thank you all. Have a good rest of your day. Bye-bye.